Hi, my name is Dr. Sharan Uppal and my background is general practice. I'm still a practicing GP, but I'm also passionate about facial aesthetics, and that's where I've set my company up, Pegi Aesthetics. So with myself, I am very passionate about what I do. So you're getting a clinician who really wants to deliver a high standard of results. And in terms of me delivering those high standard of results, I think it's really important that I continually update my knowledge and my skills. And I do that several times a year. I am fortunate enough that I've worked with some of the leading skin clinics in the UK. And I've also been first-hand trained by some of the world leading best doctors from Allergan. So you're going to get all of that expertise coming to you. Anti-wrinkle injections are essentially using a substance called botulinum. Most people commonly know it as Botox, which is the brand name for the substance, and lots of other companies produce it too. But what we're doing is we're targeting the muscles that are creasing the skin. So for instance, I'm someone that naturally frowns. When I treat people, I can't help and concentrate and that frown occurs. And I did develop a line between the brows, which I didn't like. So what the injections have done is they've stilled the muscles that were creasing the skin. So if you imagine your skin's like this bit of paper, whenever you frown and constantly crease, you're going to develop a line. Over years, that line becomes deep and forms a wrinkle. By putting the Botox in, the muscles can't do that to the skin, so it rests, and as it rests, the line softens and lifts, and in some cases will disappear as well. Essentially, anyone can have treatment as long as they're not pregnant or breastfeeding, and there's no limit in terms of an upper age limit. There isn't obviously any point in having anti-wrinkle treatments when you're very young because you're not going to have the lines to treat. But as soon as you're starting to notice lines on the skin, it's okay to have a treatment, as I say, as long as you're not pregnant or breastfeeding. Once you've had a treatment with anti-wrinkle injections, your treatment result will last approximately 3 to 4 months, after which your skin will return exactly how it was. So if you liked the way your skin looked with the treatment, then yes, you'll need to maintain. But if you are happy to allow your skin or your situation change, that you thought I can't continue to have treatments, it's okay to stop because you'll just return back to your baseline. No detriment would have happened to you from having had it. Dermal filler is a sugar molecule called hyaluronic acid, and that's something that's already native in your own skin. So once it's injected, it will blend in with your own collagen and feel like your own skin. The reason we use it is sometimes people want to enhance their own features. They might want to enhance their lips or enhance their cheeks, so you can put it into sculpt in an artistic way. You can also use it for returning people back to their baseline, because obviously as we get a bit older, you lose volume in the face, and you can put the filler in to put back what was there at one time. It can also be used to lift lines, so it's a very natural product which you can use to sculpt and shape and lift lines with. So anti-wrinkle treatments are injections put into muscles where the muscles are creasing the skin and forming lines, and that will only work if it is a muscle forming the line. You can get lines in the skin just from volume loss, so anti-wrinkle injections aren't going to work there. Dermal filler will work there because it basically lifts the line up. You can use them in combination with each other, and sometimes they work best in combination with each other, but they are essentially two very different things. With anti-wrinkle injections, it takes about 2 weeks to see your finished result. You will notice that the muscles that have been treated start to still up a bit more day by day, but by the 2-week point is when you'll see your result. With dermal filler treatments, your result is instant. Obviously there needs to be a little bit of downtime with any swelling, but you have got your instant change in your skin. With the anti-wrinkle and the dermal filler treatments, both are using a needle to put the product into the skin. So the side effects are really related to the needle. Obviously when you put a needle through the skin, you're going to get a little bit of bleeding, you're going to get some redness and some swelling. If you're unlucky, you might get a bit of bruising as well, but the bruising does tend to be quite localized and doesn't take long to go. So they would be the common ones. My favourite treatment to do is when a client comes in and they essentially ask me to just make them look their best, and they're not too specific about it. They just want my judgment on it. It does mean in that category then I can look at the whole face, and I can start from top to toe on the face and take them back towards their baseline, and sometimes even better than their baseline. I refer to it as a non-surgical facelift, and it's most commonly done in your 40s, 50s category, but can be done older as well. And I take everything into account from, do I need to reshape the forehead, address any hollow temples, lift their cheeks, give their lips a little bit more pout, address any fine lines, under eye darkness. So when I get to do the whole face, that's really when I'm in my element.